Simon, it's great to have you join and sit down with me for a few minutes to talk about a topic that you love and that's helped me so much recently. As many of our listeners know, my beautiful baby daughter Sophie was born 8 months ago, and thinking that I knew everything there was to know about chiropractic and kids, I was so wrong. We were just talking before the show about the emotional roller coaster that you go on, but when your child's screaming and there's nothing you can do, and you're almost at the point of testing your paradigm of health and thinking, do I need to go to the other side? Um, I shot you a message and you instantly got back and you helped me so much. And I really am so indebted to you for what you did to help myself, Sarah, and Sophie. So first
Oh,
of all,
that's
thank you from the
awesome.
bottom of my heart uh,
That's a pleasure.
for that. You saw a cranial strain in my daughter, which I couldn't see in her perfect face, which really helped me lift that out. And it's changed her feeding, it's changed her life, it's changed Sarah's breastfeeding as well. So thank you. But I thought we'd spend some time today talking about the importance of adjusting kids, um,
Yeah.
and how that can change the trajectory of a child's life. Um, but I suppose my first question is like, how and why did you get so into the work with children and helping adjusting and chiropractic for babies?
Well, I grew up. My father was a high-profile politician in Australia in the outback, and we had some. One of our dearest family friends was the local pediatrician, and he was like a hero, And I always thought, as a young child in my early teens, that I wanted to be like him. And I did my year 10 work experience in the hospital following this guru around. And at the end of the week, he wrote on my forms, Simon's too good for this. He said, don't do this. Do something life-giving. He said, you will only see children that are sick and dying. And I was like, oh, I was wounded, thinking, oh, but you're my hero. And yet he was so right, because by the time kids get into the hospital system, they're really on a slippery slope to, many of them die. And to surgically have to interrupt children's innate intelligence and life force and try and drag them back from the edge of death was it was brilliant advice. And so I was in this quandary of life giving. What is that? And so then I, by chance, had this adjustment. And I used to be a chronic tonsillitis sufferer. Like, we had to get the locum in every year with penicillin shots in my butt, and um, I had this adjustment, and I felt this like explosion of electricity in my throat and head. I was like, wow, what is that? And I basically never had tonsillitis again. And it was not for a year or so later, my mother said, you haven't had your annual bout of tonsillitis. And we sort of traced it back to, I was like, wow, okay. And I had no idea of the stigma around chiropractic. So I was like, well, that woman was a doctor. She's doing something life-giving. I'm in. I'm all in. And so I was just like right there. And I thought, oh, and I can do my pediatrics thing. Awesome. So I just took off, never had a doubt, um, until, ironically, my sister, then we got hooked into chiropractic philosophy, and she was a couple of years older than me, and she decided she wanted to be a chiropractor. So I was like, right, not doing it. She's stolen my career. So um, I was in year 12 going, nope, I'm going to do something else. I'm not doing that. She's stolen my career path. And then I went down to the chiropractic uni and saw the philosophy and the students, like, oh, damn it. All right, I'm in. So yeah, so that started my pathway. And then we had some really good uh, mentors in the course when I was going through in the 90s. Neil Davies and some of the older chiropractors were just real true to form chiropractors, and they had no doubt in their mind and heart that we should be adjusting children. So I was like, okay, let's go. And then one of my other really great mentors, basically the days after I graduated, one of my dear friends, who's a dear friend now, Glenn McGuinness, who's a terrific pediatrics master's, had a large pediatric practice. He said, I want to take my kids and drive around Australia for a year. Would you do a locum for me? And I was like, of course I will. And Jen and I just started our practice. So I did a locum for him for 12 months. And he saw lots of kids. So I had a rapid learning curve of adjusting hundreds of kids every week. He had a mostly pediatric practice. And so I just took off from there. And then we always use our philosophy first, Jen and I. We were like, well, when we got into practice, it was in the days where um, if you saw someone twice a week for 3 weeks and then got them on monthly maintenance, you were doing a great thing.
Mm.
And so we were like, but we get adjusted every week. And so we need to offer that to our patients. And so maybe, and we want to see the whole family, not just Tom because he's got back pain. So we just walked forward naively. We were in our 20s. We were like, what's good enough for us is good enough for them. And so we offered people weekly care back in a day when that was like taboo, and monthly fees and yearly care. And they loved it. And we had a huge community of families who would bring their kids to us first before going to the hospital and the doctor. And we thought that was normal. And so that's philosophy driven, principle driven. And we were probably naive and we just thought, okay, let's just do what feels right.
I
Yeah.
was
So
going to say that.
then,
Go on,
yeah,
carry
you
on.
go. Oh no, then when we decided to have kids, Jen, being the detailed freak that she is, was like, right, I need to write a manual for all our associates or whoever's going to do my locum. So she started writing this manual of everything she thought was important about looking after kids and families. And I remember one day I was taking to Officeworks this literally a ream of paper, and I said to her, I think we need to turn this into a book, because I started giving it to mothers saying, I'll copy this book for you because you'll get an idea of all the things you got to think about with pregnancy and birthing. And so I was like standing there at the photocopier going, this is ridiculous. This should be a book. And that's how Well-Adjusted Babies came about. We were just like, oh, everyone needs this information. Let's just do this. And so we just set a deadline, and with a baby on her breast, Jen and I self-published this book. We had a few meetings with publishers, and they were like, oh, this whole mention of how to avoid antibiotics or what to do about vaccination. Oh, it's a bit ahead of its time, and it's not going to be well received. And we were like, all right, well, we'll publish it ourselves. So we did a self-publishing run, and it sold out within weeks. The chiros loved it, and then it just started. Chiropractors were buying it by the box, and so we just launched into this space and have never looked back.
Such a great story. And with the Well-Adjusted Babies book is the most popular one on our bookshelf in the practice, so it does something good. It is a Bible in our house. Um, every time I ask you a question, you say, "Tom, just go and find that chapter in the book," and it's just
Yeah,
perfect. It's all there. But you said a couple of things as you went through there. You said certainty and no fear. Those old timers who had the no fear. You guys just had you said naivety, but I think just the knowing. And I
yeah,
do think that's something that chiropractics lost a little bit, that certainty in what
yeah,
we do. You know, for someone like, for instance, this week I've been seeing a lot of babies recently, which is cool. But this mother brings a baby in who hasn't had a poo in a week, and she's like, "I'm going to take to the doctor this afternoon." So, well, why? Why? Like, where's that gonna go? But a lot of people will be fearful of having that conversation and not trying to intervene, but just give a voice of reason.
yeah,
What do you think chiropractors can lean on to with certainty? Because adjusting kids is still a little bit of a fear place for chiropractors. I know with associates that I have, some of them are very comfortable, some of them are very fearful
yeah.
of working with kids. And I think the fear comes around not doing the wrong thing. What I suppose, what advice do you have to chiropractors who really want to see kids, but they are nervous? I mean, obviously come on your courses
Yeah.
and read that book, but what advice do you think you have for them?
Well, there's I think the most intimidating thing, children's spines are amazing. They don't complain because they can't talk most of the time. And it forces you to use your skills to find the subluxations and correct them. And usually there's only one. So it's not like you're looking in this extensive, you know, screwed up mess that most adults are. So it's pretty straightforward technically. So once you learn the basics of the 33 subluxations that might be in the spine, that's a generalized term of, I say to young grads all the time, there's really only 33 segments or areas that can get subluxated. Just learn how to check and adjust to all of those and modify your techniques for the kids. And then let innate do its thing. I think I resisted, and chiropractors resist a lot, thinking it can't be that simple.
Mm.
But it is. The old guys were right. The backbone is connected to everything. And I find myself saying this a lot. Parents are going, oh, they haven't ever looked into this space, and they're thinking, I got to go to the doctor or use Panadol or medications. And you go, no, 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 no. The backbone is connected to everything. And so just like the fuse box at the front of the house, if we switch it on, this pooping's going to work again. And so as a chiropractor, I think if we just got better at trusting our craft, it is what it is. It will work in at least 80 to 90% of the time, especially with kids. I think the biggest issue is that with a child comes this extra scrutiny, because you're sitting there holding a child. You've got mum over this shoulder, dad over this shoulder, grandma is sitting there, and all these opinions from the community. And so you've just got to hold that anxiety still inside yourself and go, all right, I've got this heat. It's just heat because they love this kid so much. And that heat can pivot so quickly because, I mean, no one talks to anyone in their community about the fact that they're coming to get adjusted today. But when a child comes to the chiropractor, there's about 15 to 20 people that are going to hear about it. And they will have their opinions. But every person, I'm going to take the child to the chiropractor and we get adjusted. And people go, oh, why? Oh, my gosh, what's that for? So it starts this whole dialogue that can be a great promotion source for you, or it can be a nerve-wracking hell ride for you. And so it's probably needing, we need to, or young chiropractors or people that are not confident with kids, just need to borrow that confidence from the old guys to go, hey, this is going to work. I know you're looking at breathing down my neck. I will not harm your baby. I'll only do things that are going to be wonderful, beautiful, nurturing to this child. And watch this space, because this is what chiropractic is made for. And then everyone starts to talk about it. So when I graduated, I was 22 and I looked like I was 15. And I had nothing, I had no experience. And people would say to me, are you sure? Like, how old are you? And I'd be like, oh, how old do you think I am? I had to lie because I had to wear a tie just to look old
Yeah.
enough. And so I borrowed the collective we. And I would suggest that anyone that's not confident, borrow that confidence from us to go, the miracles will happen under your fingertips. Just lean in and be brave and go, okay, Simon said, Tom said, chiropractic works for kids. Just lean in there. And
That's
if
so
I'm,
true in terms of chiropractic, I think in general. Like there's this thing that we need to try and fix this person who's in front of us, and that's not how chiropractic works. Like you're adjusting them, and like you said, trust the innate. We all see
yeah,
it in practice. A lot of times you see chiropractors, they do loads for anybody, whatever age, loads of stuff to the patient. You're like, well, do they actually need all of that?
mm-hmm,
Think about the sickest person in the practice. You probably do the least for them, and they get the best
yeah,
results.
yeah,
I think our ego gets in the way a lot. Um, it's funny because I remember Sarah before she became a chiropractor. She used to come into the practice, and every time I had a baby, and before she became a mother, I'd call her over and say, "Sarah, come here, hold the baby," and thrust it on her. And Sarah's holding it like a rugby ball, we
yeah, yeah,
can't hold a kid. But I
yeah,
think you've just got to. I think that's where a lot of people lack a bit of confidence if they haven't had kids as well. Is just
yes.
understand that this thing is okay. It will wriggle a little bit, but you're not going to hurt it in the process.
And if that's the hurdle you've got to start with, because parents can see whether you are comfortable or not,
Mm.
and they can see that nervousness, they can smell it, because their limbic system is on high alert with everything to do with their child. So if you're not confident holding a kid, just get out there in the community and ask people, can I hold your baby? Just you got to know how they feel, so that you can look more confident and handle it with care, and make sure you've got the right props, like a pillow that you can lay the baby on that makes them not roll off your table. And it's just there is a whole communication of confidence that I would suggest you learn. We talk about that in our seminars. We go through that because it is important to appear confident, even though you might be sweating like a pig, and stressed out on the inside. You've got to sort of pull that Zen feeling in, and like look like you are you are there, and then just focus on your job at hand, which is to remove the subluxation, and then I think one of the things that Jen and I both encourage a lot in our profession is that we we're at a point now where we need to uh, be better at sharing instead of competing.
Mm,
And so it would be our fantasy and our hope that um, we as a profession get used to standing on the shoulders of giants so that we can reach higher. And there has been a culture of that. A lot of the giants that we were fortunate enough to mix it with, Charlie Ward and Sid Williams, and I could go on and on and on about some of the wonderful, like, Reggie Gold, were all from our era when we were new graduates. And so we were able to stand on their shoulders and reach higher heights. Um, in the pediatric space, Joan Fallon, you know, Neil Davies, some of these guys who wrote textbooks and are incredible leaders, enabled us to stand on their shoulders. And we would like to do that for everyone else in the profession, to go, you know what, hop up here on my shoulders. Don't try and compete or push. We need to be brave as a group and go, come on, get up on my shoulders and reach higher. And if that culture was there, like with you and I, to go, hey, I can see something from my experience through a picture, and then bang, you get integrated active learning, and that stuff drops into the headspace. We should be sharing our knowledge. I've got a private Instagram page called Chiro to Chiros, where we're just trying to, I'm vetting only chiropractors can come in here, into that space, so that we can start sharing our craft, because otherwise it's going to get stolen. And already the physios are trying to take on board some of our great work. And so we need to be protecting this sacred trust and sharing it, like the craft that it is, instead of withholding and trying to be competitive with each other. This is about the community.
I definitely
So
see that in you and Jen, actually. Like, having to get to know you guys over the last couple of years. Um, you really are very generous and gracious with your time and your knowledge. And the other people in the pediatric space that I know are too. And I think for people listening to this, don't be afraid to reach out,
yes.
because there's always help there. Um, and I'd say reach out, but also compound that by attending the courses, because they are invaluable. I mean, in Ireland, when Jen was at the same conference as me and you were joined us virtually, the stuff that I learned in those couple of hours was extraordinary. And ch it changed my practice. Um, one of the things you
Awesome.
spoke about in that was the tongue tension, which I found fascinating,
Yes.
and I've seen a lot of actually. Um, very interesting. I've got a slightly older child in at the moment who is having a lot of seizures, but she has a full set of teeth and knows how to bite. Um, when we're working on this tongue tension, it bloody hurts, but it's
Well,
really
I put
changed.
a I got some tongue depressors that I've never used, and I put because you can slide the tongue depressor in, then flip it sideways,
Ah, and then
and
you
they
can get
can't
under.
bite down. And then I get my finger in there without losing the finger.
Well, that's a good
So
idea. I've learned
I
something
know
for the
I
next
had to
time.
invent that one from the horror experience of nearly having my finger bitten off. But again, you have to get in there, and you have to, why wouldn't you use a manual release of the tongue instead of using laser, which could damage tissue and regularly does, or physically cutting something, when you can release all of
Can
that
you
neural
can you just
tissue and impact it?
explain that um, correlation, because that's something that I just did not know, the correlation between the tongue, the nervous system, spinal cord, because I think it was, well, it was huge when I heard it. I suppose if you
Well,
in brief.
what most of us don't realize is that, 2/3 of the tongue sits within the ramus of the mandible. So it's what we see is only 1/3. And so realistically, it's going to be knotting and whirling of the soft tissue in that space that is going to impact the ability of the tongue to draw milk into the mouth. And then, literally at the back of the mouth is where the C1 is. And just, posterior to that, we're talking millimeters posterior to that, is the brainstem. And the brainstem is what's controlling. I say to patients all the time, there's 7 vertebrae in the neck, there's 12 in the mid back, but there's 12 in the space of my thumb, less than my thumb, in your child. And if that's congested with whatever interference is there, then it's going to affect the eyesight, the sinuses, the breathing, the swallowing, the gastric system, like all the automatic nerves. And so the reason why your child just eats and sleeps and poos its pants is because it is learning, and the brainstem is learning how to operate. And without good organization in that brainstem, things are going to go left or right of field, and we don't want that to happen for your child. Speech and tongue movements are more intricate than handwriting, and the child's got to learn all that. So if there is issues in that space, we can tell that it's either a growth and development thing, that the tongue is physically knotted or tethered or what have you. It's less likely that that's the case because Mother Nature is so clever. Very rarely would you have a structural issue with a tongue. However, neurologically, all of the jamming and irritation in the suboccipital region, these children are getting pulled out, they're getting tugged sideways, they're getting, even with cesarean births, they use forceps to drag them back out of the canal. And so it's very traumatic. And so, of course, the brainstem needs to be unpicked and released and decongested. And that's what adjustments do.
Mm.
And all the things we teach on how to get into that space, because it is so small, there is ways to release that from the periphery, working through all of the, all the nerves and muscles that are supplying and working into the brainstem. Also, just dural release. Simple pediatric procedures that get response immediately are the things that the chiropractors need to learn and have confidence in looking at, because these kids are getting worse, not better. And it's nice to own that space. Go, yep, I can help that. We can help all of the growth and development. In Jen's second book, the whole middle section is about the developmental milestones, and it focuses the parents on neurology and watching their child's nervous system develop with all of its key criteria to be a happy, healthy child. And so you're not just waiting for them to be a bedwetter or a chronic ear infection kid. You're actually getting the parents, you give them the book, and it says, look, our job is to make sure these children are checking off all these developmental milestones from 0 to 12 years of age. And do you know what? Most chiropractic kids excel, and they smash through these developmental milestones. And that's why you get them adjusted regularly, because you're going to have a child that's developing super, and they're not just in a good paddock, they're in a great paddock, and you can have confidence in that. And that's the other.
That's the ramifications, isn't it? Like long-term health.
Yeah. And we're fortunate enough, when we were going through this time with our young kids, we had no idea what the way we were bringing them up and the amount that we were adjusting them was enough. But we've got a sample set of 4 kids, all of whom have never had antibiotics, never been to hospital, never had paracetamol. They are, one of our children has been put up 2 years in school because they're just like, he's too bright. They communicate well. They're in this paddock of organic, grass-fed, intelligent. They never had skin issues and acne, and they never have been depressed. And so there's this incredible, like they also have really good muscle conformation and strength. And I'm not just saying this as a parent. They are glowing examples of healthy young kids. They are bright, intelligent, and there's a sample set of 4, not because Jen and I are particularly bright or we've pushed them, but their brains work. And you can see the difference. Even when children are 1 and 2 years old, you'll see that these pure sparks that are riding this great wave. And that's what we know now. When you can have your children not contaminated, you can have their nervous system flourishing, and all the priming of the nervous system happens with the adjustments and the way we bring these kids up. So there is a pruning of the nervous system that gives them super good coordination, super good communication, clarity in their nervous system that I can promise people. I've got enough patients now who have been seeing the kids for 20, nearly 30 years, that these kids are bright sparks and they really do flourish. And so you can borrow my confidence in that and our confidence to say, I promise you, well-adjusted kids are well-adjusted.
I suppose with that, that's a really interesting point. Like, I see the difference in Sophie. She's 8 months old now, with her peers of our sort of antenatal group. It's a dramatic difference. Mainly following the first intervention that kids have, you just see the lights go down slightly.
Yeah.
A lot of chiropractors see kids, let's say for like colic, sleeping issues, feeding issues, when they're young and like with sort of a few months old, and then that child gets better, uh, quote unquote, and then they fall out of care. How, what communication could a chiropractor use to try and keep that child in care? Because we know that it is a lifelong thing. Chiropractic is a lifelong thing for
Yeah.
both adults and children. When they start to lose that or wane that interest because their baby's feeling better, it's precious, my baby's perfect, I'm okay now. Is there any sort of communication that you'd use at that point to help?
Well, I try from the very get-go. I say to people, look, I know your expectations are this, that you would like help with ear infections or colic or what have you. My goal today is to upgrade your expectations because, you think you're coming to an a la carte menu where you want to order relief from ear infections. I'm actually going to show you this buffet we have of options that will help your child thrive, go to school well, eat well, have a good immune system, all those sorts of things. So, step one is you think this. I just want you to know up front, I'm going to raise your expectations because chiropractic is much more than you may necessarily perceive. And then the reason Jen and I have developed some of the resources we have is for that very reason. Her Ticklish book um, is one of those things you can read it in an hour. Well-Adjusted Babies is a behemoth Bible. It's a huge undertaking, and it's culturally incredible because it gets people to hold that book under their arm for the rest of their lives and just march through life going, I've got this because I know all the answers. Jen's put them here with references. Um, but Ticklish is a sweet little easy book all about focusing the parents one step at a time with one little step. So on every page, there's a little tip for how to um, help a child's visual development, how to minimize screen time so that their brainstem's not getting overwhelmed with too much visual, how to get them playing on the grass and outside, and why berries are really good and why oils and just simple tips. And then, like I said, the whole middle section, I say to parents, here, this is for you. You're going to fill out all the developmental milestones, and Jen's put in their suggestions if children have got lag. And so it focuses them on the nervous system and the development. Of course, we're going to work with this ear infection, but I want you to look at what this history of this child's been and the development up to date. And then we are going to work at advancing your child. How about that? And everyone goes, heck yeah. I want a child that I don't want it to arrive at school and get some sort of diagnosis then that Johnny needs to have extra help here and there. We want to be ahead of the game. And there's not one parent that wouldn't want that for their child.
Mhm.
So our book, the reason we called it Ticklish was because our job as parents is to tickle our children. You can't tickle someone that you don't know and love. And we're just sort of gently tickling them along in life and go, oh, come over this way because, Sarah might not like swimming, but Johnny likes running. And so our job is to go, come on, we have to go down this pathway of development. We have to keep your nervous system going well and your immune system. So we're just going to walk this way gently, rather than push them and wait until they fall over. Our job is to just, as parents, guide them. And that's how I get around it. I'm like, it's part of what we sign up for is to, we look after their manners. We make sure they can, have good toilet habits and reading. Well, neurological development is a big part of that. And especially in this era when so many kids are autistic and spectrum. Excuse me.
I think that's the having that honest conversation early on is brilliant, and hanging your coat on something and standing for something again is back to what we should be doing as chiropractors. The stuff that you're sharing is invaluable. So, um, I've tried to get on your course a couple of times well, last year, but I couldn't make it. But I'm gonna get on it this year. So where can people find out more about what you're doing, uh, where your courses are, and what resources you've got, so they
Sure.
can share from that knowledge pool and really grow their practices and change lives?
Well, one of the things is the welladjusted.co. It's .co, not .com. Um, Jen has 15 years worth of blogs on there. And because we had so much scrutiny in Australia from the government, they're all fully referenced. So you can literally get on there and look, just type in ear infections or allergies or anything that you think that will come up. And I just literally copy and paste that link and I text it to patients tells them all, and everything she ever writes has always got a chiropractic hook in there. Get the kid adjusted by the chiropractor. It's only ever going to support them coming back to you. You can learn, like with well-adjusted babies, a lot of the chiropractors read that and go, okay, now I understand the vitalistic approach to pregnancy and parenting. All of our products focus the parents back on getting the kid adjusted and checked regularly. Literally, when parents read well-adjusted babies and ticklish, they're like, okay, don't know when the birth's going to be, but how do I book this child in straight after the birth? Because I know that that's going to be an important thing to do. So first of all, the welladjusted.co website has got huge amounts of resources, all fully referenced, that you can borrow, literally click the link and copy and paste any topic that comes up with regard to kids and pregnant women. It's on there in her blog section. And then all of our seminars, we have 11 bookings this year in right across the world. And so we are we are marching around. We have incredible modules where we go through what we call the 33 subluxation modules. Everything we do focuses back on the central nervous system. All of our techniques, all of our adjustments are looking at the nervous system, the autonomic nervous system as well. How we're using techniques to balance that, and I suppose we've done so much technique work from all of the greats that we're now distilling it back into like all of the. It's been probably 50 years since SOT, AK, activator, all of those different techniques, even Gonstead. Those guys have all been gone a long time. And the modern epidemic, especially with regard to children and the stresses they're having, we have to adapt our techniques as chiropractors to make sure we're addressing much more of this autonomic nervous system dysfunction, dysregulation, and using adjustments to really balance the nervous system, and then teach the parents to observe that as well. So we talk a lot about soft neurological signs, watching children going, okay, that child's not developing properly. Whether that's speech or walking or communicating or just being able to make eye contact. Let's get onto that early and prune those synapses in the right direction rather than just wait until they get some horrible diagnosis when they get to school. We can see this stuff, and we are uniquely trained to watch the subtle signs of the nervous system. So we really want to empower the chiropractors to go, I got this. And they see kids in the community and say, I got this, I can help you. And change the lives early on rather than wait till it's not too late. It's never too late, but it's much harder once the growth and development has slowed down to have the change you can have when you start adjusting kids early.
Perfect. Well, I'll put the links to Well Adjusted Co in the show notes. People can get to that really easily.
Awesome.
And I will see you at one of your events this year. I'm really looking forward to it.
Fantastic, Tom. Thank you very much. And we actually have also realized that the chiropractors are a bit wasted, especially after the pandemic. So we're doing our first retreat this year in Spain. We realize we're going to try and really have an immersion experience where we can all realize that we need to recharge. And as couples, especially when there's couples who are both chiropractors, how do we balance that with the kids and life and make sure that you still have all those balance things in check for you as a practitioner, and then make it fun instead of more stress, more hassle. And that's why we want to have 5 days in a beautiful location on the Costa Brava overlooking the ocean, and just really be able to have quality time with chiropractors where we can all share, how do we do this better? How do we preserve ourselves? I'm still 30 years into practice. I love it every day. My body is the fittest and healthiest it's been. I don't feel like I'm burnt out. And there's a reason why. There's certain things you have to do on a regular basis to keep yourself in check, because you can't just keep giving out of an empty tank.
Mm-hmm.
And then also with kids and relationship, like we were joking about, you can have to go without sleep for days when you've got kids, and you didn't know that was coming. And that's going to affect your concentration and your ability to be a good practitioner. And so there's little pivots we have to do to make sure that we are putting back in our own tank rather than ending up whipping the horse to the point where you're burnt out. So we really want to cover that off too and help look after the healers.
Where can we find out, and where can I find out about that?
That's all on the welladjusted.co
Well, just
with
go.
the seminar listing. Yeah, there's all of our seminar dates are there at the different locations in the US, UK, Germany. We're all over Europe and America this year.
Amazing. Amazing. Well, Simon, thank you so much for your gracious time today. I really appreciate it. I know the
Thanks,
audience
Tom.
would have got so much from it. And I do encourage everyone listening to follow up and look at those resources and find out more.
Beautiful. Thanks, Tom. It's great.